Welcome to Ask Alumni, the podcast where we talk to alumni of Loma Linda School of Medicine to gain insights and information to help students and young alumni on their medical journey. Hello, my name is Calvin Twang, and today we're going to be talking about the wonderful world of vascular surgery with Dr. Kristyn Mannoia from Loma Linda, class of 2011. Dr. Mannoia, welcome to the podcast.
Thank you so much for having me.
Now, you're a vascular surgeon. I'm not familiar with vascular surgery, and I'm sure there'll be some people listening who aren't familiar. Would you mind explaining to us what your career involves?
Of course. I think that's a common thing that most people don't know what vascular surgeons do until you meet a vascular surgeon. Basically, I treat blood vessels all over the body, the arteries, veins, and lymphatics, everywhere except for the brain and the heart. So most of the rest of the body is fair game. We use surgical techniques, so open surgery, endovascular techniques, so we can, use the wires and the catheters and the newfangled stuff. And then a lot of what we do is actually medical management and surveillance, and just getting to sit down and chat with our patients and see how they're doing.
Oh, nice. Mm-hmm. And how did you arrive at this specialty? What was the journey like between, let's just say, college all the way up to now?
Yeah, I guess I would say probably I arrived on accident, which is another way of saying it was divine intervention. From college, I had no idea what I wanted to do. So going into medicine was not my first choice. I actually was a philosophy major, and I thought that I wanted to sit and read, which I still would love to do all the time. But I wanted something that had some practical application. And so I started taking some bioethics classes. And then I realized that nobody would listen to me in bioethics if I didn't know what the science was. So then I started taking science classes. And then I realized I really liked the science classes and the kind of the natural progression of I want something that I can do, some practical application of science, ended me in medicine. And then from there, it's kind of the same progression. I saw some surgical, some surgeries in one of my early rotations and thought, oh my gosh, that's exactly the practical application that I wanted. Like, you do a surgery and you see the result and you get the happy feeling. And so I really liked surgery, and I liked everything except vascular surgery starting residency. I started residency saying, I'm going to do anything except vascular. I don't like it. I don't, like the things that they do. But as I kind of dug deeper throughout residency, I had some really good mentors who showed me the beauty of it, the creativity in it. I like that it's very unpredictable. You never know what you're going to get. And one of my worst fears in life is being bored. So so I ended up feeling like vascular was a really good place for me to see a lot of that practical application, immediate. And then also there's an element of vascular surgery where we work a lot with other fields. And I like that we, in some cases, help other fields, and in some cases need help from other fields. And so there's a lot of integration, a lot of problem solving, and a lot of continuity of patient care. So I think it's the best of all possible worlds to be a philosopher again.
Yeah, and that's actually quite fascinating. So you end up, you start with being a philosopher, and then you end up here, and even halfway through the process, you really didn't want to be where you are now. But many good life applications, philosophical life.
It definitely is. Yeah, I know. I do a decent amount of work now with the medical students and some residents too. And I keep telling them, like, you don't make plans. You can, and they will be completely different. But looking back, this is exactly where I'm supposed to be.
That's great. Having done this, how long have you been doing this now?
I've been at it, so it's a 7-year training process. Okay. And so I've been out of training now 4 years.
Okay. And knowing what you've done now in the last 4 years, looking back, if you were a student, is there any information that you would have liked to have known as a student?
I think for vascular surgery, I didn't have much exposure to the cool parts of it, and so I would have liked to know a little bit more about vascular and get exposed to it. That's something that I'm trying to do with, working with the medical students. I think in general, for medical students, this isn't vascular surgery specific, but there's a lot of different places where you will be happy. And you can be happy and you'll be fine and you will be challenged and you'll affect change and do all of the things that you want to do. So the need to, oh my gosh, I have to find the one right thing for me and I have to narrow it down with all of these different things. And I didn't like that part of that, so that can't be what's right. Like, just if you kind of let go and follow, I guess that's how I did it, just ride the river, see where it takes you. And if your choices are God honoring, and, you'll end up in a place where you'll be happy.
Great. That's great advice. I'm sure someone listening that will be very helpful to someone listening. So back to vascular surgery, what does a typical day look like for you?
Yeah. A lot of it depends on where you're practicing as a surgeon. There's a lot of surgeons who are community-based and they don't do a whole lot of inpatient. And for me, being at Loma Linda now, I have a day and a half of clinic where I see my patients and I get to catch up. And then I have usually a day and a half of OR time where I'm in the operating room doing surgeries that are planned out ahead of time, hopefully. And then there's usually some empty space in there where I get to do like student teaching. We have a residency program and a vascular surgery fellowship. So there's a lot of, conferences and teaching with that. I think vascular surgery is somewhat unique in that there's a lot of emergencies. Probably in our practice here, maybe 40% of our cases are urgent or emergent. And so, we get a page that somebody is in the operating room and encountered some unexpected bleeding, and we have to drop everything and run, or, a transfer from an outside hospital where there's somebody who has a ruptured aneurysm and you have to, kind of make room for those emergencies. There's never a dull day or a week that goes according to schedule, I would say, at least in our practice here.
So it's very like walk into work.
Yeah.
What's going to happen today?
Yep. Yeah, that's exactly it, which I really like. Like, all right, come on, hit me with what you got. Let's see. Nice.
Mm-hmm. And now you're at Loma Linda. It's an academic setting. Is there any difference, would you say, between an academic setting and, say, a private clinic, and what kind of differences would you see in those two? Yeah,
I think there are definitely differences, and the beauty of vascular surgery is that you can really do whatever you want. So there will be people in a community practice who do exactly the same thing that I do, and then there are people who only do a small segment of it because that's the kind you like, and that's totally, that's great. I think probably what we are more prone to seeing at Loma Linda are more complicated cases, things that, somebody who sees them in their clinic and says, I don't think that I can, take care of you adequately with the resources that I have right now, or other places where they've had, complications or more of the complicated things. I will say that was a little bit of I had to grow pretty quickly starting here, because right out of fellowship, at an academic center, I'm ready to take on the world. And then you get a call from a surgeon in the community who, has been practicing for 25 years. And they say, this patient is beyond me. They need to go to Loma Linda. But just by virtue of kind of being at a place like this, you have to say, all right, well, how am I going to handle it? So it was a little bit of a learning curve. Having wonderful partners that can come alongside and mentor me has been wonderful. But yeah, I'd say that's probably the biggest difference. That, and then also having trainees. Probably a lot of people in the community might not have. We have medical students, we have general surgery residents, and we have vascular surgery specific trainees. So they kind of keep you on your toes.
Nice. And you just mentioned there, you know, being referred to by someone with a lot of experience and then coming in as a new professional. Well, not a new professional, but out of fellowship and having that support of a team. Is most of your work team related, or is it as a clinician or as a practice, are you more individual based?
I think, you know, I'm sure you could say this about a lot of specialties, but they say that if you have 3 vascular surgeons in a room, you're going to have 5 different opinions on what you should do. So there's one of the things I really like about vascular surgery is that there's a billion different ways that you could do whatever it is that you need to do. And I think it's essential to have people who are your sounding boards that you can say, this is what I was thinking about. And they'll say, well, what about, you know, coming at the profunda in a lateral way? Or, you know, have you thought about what are you going to do for distal control? Or what are you going to use for a graft over there? Because looks like there's some, whatever. Yeah, I think having those team members is, at least in the way that I would like to practice, is essential for me. Yeah.
Right. Now, vascular surgery, is it specialized enough that it is mostly concentrated in, say, large cities, or is this a specialty that you can find in more rural locations?
A little bit of both. Vascular surgery as a field has kind of exploded with growth in the last 20 years or so. So there's a lot of techniques that you really will only find in certain places in bigger academic settings. And, you know, there's some really cool work being done, but there's, you know, what they call bread and butter vascular surgery that's been taught in residencies for, you know, since the advent of, you know, the carotid endarterectomy or the AV fistula. And there are plenty of very well-trained surgeons who haven't had specific vascular training, but general surgeons who can do those kinds of things. And so in the rural areas, it usually falls to them to take care of those vascular surgery problems. So both, and as an answer to your question.
Okay, fair enough. And how about internationally? If someone was trained here, is those skills transferable internationally, or do they have different protocols overseas?
That's a good question. I think it is transferable for sure, and especially open surgery, you know, that's going to stay the same no matter what. Where it might vary is there's a lot of technology in vascular surgery, especially in the endovascular world, stents and wires and catheters. And so the difference, number one, it might be hard to access those if you were in an area, you know, a more rural area overseas. But also there's probably different, you know, things that aren't FDA approved or that their regulatory bodies have approved. I think the US tends to be actually a little bit more conservative in approving things like that. And so international vascular surgery is, I would say, a couple years ahead in those situations. Yeah, but definitely the open skills are fundamental.
We're talking to Dr. Kristyn Mannoia here at Loma Linda University. More of her after this short break.
This episode is brought to you by the Paying It Forward Scholarship of the Alumni Association, School of Medicine of Loma Linda University. Every year, junior and senior medical students at Loma Linda University are eligible to receive a scholarship equivalent to half of 1 year's tuition. Students who receive this scholarship also receive advice and encouragement from the alumni who helped fund their scholarship. For more information, visit llusm.org/paying-it-forward-scholarship or call 909-558-4633. Support also comes from the Student Ambassador Program of the Alumni Association School of Medicine of Loma Linda University. Did you know medical students can receive honorariums starting at $500 for encouraging Loma Linda medical alumni to become members of the Alumni Association? Simply have alumni credit you in their perpetual membership upgrade. Help us build our community today. For more information, visit llusma.org/student-ambassador or call 909-558-4633.
Welcome back. We're talking to Dr. Kristyn Mannoia, vascular surgeon at Loma Linda University, talking about her specialty in vascular surgery. Now, let's talk about lifestyle for a while, a moment, because a lot of students consider lifestyle when they choose their specialty. What's the hours like? Are you on call? Can you describe that?
Yeah, for sure. I think you could say just like a lot in surgery in general, but I know the most about vascular surgery. You can make it what you want to. I have friends who don't take call at all. They do their work in an outpatient setting and they're home by dinner. I did not choose that route, but I still am home by dinner most days. I think hours wise, it depends on where you're taking call, how many partners you have. So here there's 6 of us. So I have one weekend a month usually, and then a weekday most weeks. And I get to work. We have conferences early in the morning. Surgeons tend to be early risers. So we have our conferences rather early, but I made it a point actually in residency, in fellowship, when I had my first daughter, to always be home for bedtime. And so I think there's been 2 or 3 bedtimes that I've missed since then. But I think it's definitely doable, lifestyle wise. The call, if you're comparing it to say general surgery call, we get far fewer calls. Like I can go 3 or 4 calls. I am on call right now, so I'm definitely jinxing myself. Like whoever, don't, I need like a bubble of silence right now. My pager's over there. But I can go 3 or 4 calls without having to come in and do anything, or getting any calls. But when I do get calls, they tend to be much more emergent. There's not a whole lot of observation with a ruptured aneurysm or an acute limb ischemia or something like that. I think that I have dealt with a lot of those critiques, and I think part of me being a little bit ornery when people say, oh, you're going to want a family. You're for sure going to want a family. You won't want to do surgery. And so I have tended in my head, not out loud, to say, oh, okay, really? So watch me, I will do it, So I, just as a story, and I am one of many people who have done this. I had my first daughter. I was 8 months pregnant when I started fellowship. I had my daughter a month in, took some maternity leave, and my program was very supportive. And, like I said, I was home for bedtime. And if I had to go back afterwards to do whatever it was, then I did that. And then I had another kid a year into practice, and again, took a full maternity leave. I took 4 months, which was really nice. And my children still recognize my face. They know who I am. I'm their favorite person. So those were all worries that I really did genuinely have, like, are they going to like the nanny more than they like me, or the grandma who's babysitting them, or whatever. But I think for me, it's been important to pick the things that really define for me, like being a mother or being a surgeon or whatever it is, and focus on those things. And if that means that, I don't cut their sandwiches into the shape of a star for their lunches at school, then that's not that big of a deal to me. But I think that I won't say that there's balance, because that's never the case. There are some days where I have to focus a little bit more on being a surgeon, and some days where I have to focus a little bit more on being, a mom or a wife or a, part of my family, or a philosopher that likes to read. But I think that you can make it work if you want to.
As someone who didn't get their sandwiches cut into stars as a kid, I think your kids are going to be okay on that front. No, I think it's actually great that you mentioned this, because I'm sure there are some people, particularly females, who may want to become a mother and considering specialties and saying, maybe surgery is not for me. How did you find being a mother and that balance between being a mother? You mentioned it a little bit, but could you elaborate on that a little bit more?
Yeah, for sure. I will say, number one, the most important thing you need is a village of some kind. I have an amazingly supportive husband. He's an ER physician, and so his schedule is a little bit more predictable than mine. And he is a fabulous cook, and he likes to do all of the bill paying. So I am very lucky in that regard. But having that kind of a village, I think, is necessary. When I had my first daughter and my schedule was much less predictable as a fellow, we were in Texas, and my mom and my husband's mom took turns coming out for a couple weeks at a time to take care of our daughter, so that she would be taken care of. So that's like number one, I think, most important if this is the path that you want to take. I think that in terms of being a mom and a surgeon, I am a better mom because I'm a surgeon, and I'm a better surgeon because I'm a mom. I think that, in a lot of cases, we're, as a society, almost like rewarded for segregating our lives and saying, this is when I come to work, I'm sorry, the nanny's going to take care of the kids. I can't think about it. Or when I go home, I'm not going to think about my patients. I'm going to, turn that part of my brain off, put the textbooks, whatever it is. But I think that, the integration of those parts of myself has been helpful so far, and I hope to continue. I'm by no means like arrived or anything like that. There's definitely areas that I really am working on. But I think that's been my goal, is to kind of acknowledge that I am a whole person, and I can't expect to segregate myself like that. And my daughter now knows that when I leave, when I get a page, she's like, "Oh no, Mama has to go help somebody." Yeah, I do. She likes to look at the anatomy textbooks with me. She's 5 and she knows what the bones are, and so I don't know. She might have troubles in school with. She knows all of the anatomic parts and everything, but she really likes that, and so I like to kind of keep her involved in that way, and let her know that why I'm doing what I'm doing. And in the same way at work, I am very clear that my kids come first in a lot of cases, and I take them to their doctor's appointments, and I took a couple days of vacation for my daughter's first day of kindergarten in 2 weeks, which I'm dying on the inside about, but I will act really happy that day. But those are times when I really want to be a mom. So those are just ways that I've tried so far to make it work. And like I said, I think my kids are pretty cool. So I hope I had some hand in that.
Oh, I'm sure you had a hand in that. But you do bring up this very, if we're going to get philosophical temporarily, this dichotomy that we aren't just one thing or the other. You are both, and to deny one is actually probably robbing you of this extra benefit that it provides in another space. So yeah, that's really interesting.
Yeah, for sure. I think it's even harder work to keep those things apart, because that's not what our brain wants to do, And I think there's probably a lot of the stereotypical, the surgeon who's hollering in the OR, it might be because there's something happening at home that's really stressful, and they don't know how to integrate those things in a healthy-ish way. Yeah.
Is your field a split between male and female as far as the makeup goes? Like, what is the makeup of your field?
Mm-hmm. I think in terms of practicing vascular surgeons, I think it's somewhere around 10% are female. That is increasing rapidly. I think trainees in fellowship programs, I don't know the numbers off the top of my head, but I think it's something like 30% of vascular fellows are females. And then there's a newer pathway that's an integrated residency for vascular surgery. And those actually, there's a majority of women. I think it's 60% of those trainees are female. So I think there's been a lot of changes in the field of vascular surgery in the last 20 years that have helped. And then also, I think the field of vascular surgery is very small, and this is, the community is small. And so I think they've been really, they should be applauded for realizing that balance is important, and, physician wellness is important. And I actually serve on the wellness task force for the Society for Vascular Surgery, and we're working on a coaching program for vascular surgeons, and lots of things that the community has kind of jumped on board with really laudably to improve the diversity and the equity and inclusion in the field of vascular. So I think that it won't be 10% for long.
Okay, that's great. That's fantastic to hear.
Mm-hmm.
Let's talk about a little uncomfortable situation. Not uncomfortable. Some people are uncomfortable sometimes talking about money, but it is a consideration as students and as residents look into their careers. Yours is a very specialized career. How does it rank in the field of medicine as far as how lucrative is it from money perspective?
A lot of it depends on your practice setting, obviously. Here at Loma Linda, we're salaried, and so I like that in that I don't have to meet. Well, I have to meet minimums, but I don't have to worry as much about the overhead.
Oh, sorry, I lost you there for a second. Could you don't have to worry about the what? Sorry.
Keeping the lights on.
Okay.
There will be lights on in my office when I come in there, and I will have an MA in my clinic. I think if you are in that situation, it's probably above average for surgical specialties. If you are in your own practice, I would say that I have seen vascular surgery on the top 5 for reimbursement list. And it's those kinds of situations that where you can make that happen, where you own your own surgical center or angio lab, and you're kind of able to control all of the parts of it. And if you're business savvy, which I am completely and utterly not, ask my husband, you can make that work. But surgery in general is a little above average, and vascular surgery is a little bit above that. Yeah.
Okay, great.
I don't know if you want numbers, but
I mean, if you know of general numbers of what one of these top 5 people would do if they went into business, do you have a ballpark? Do you know?
I think you can get in the $600,000 and $700,000 range.
Wow, that's great.
Yeah. Again, that's if you. I tell a story that is the opposite of what my practice is, but my husband works in the ER, and he said there was a new vascular surgeon in town that came and met with the ER physicians and said, "Hey, I'm here. Here's my cell phone number. Call me anytime, night or day. Even if I'm not on call, I will be available for you." And those are the kind of people that make, $250,000.
Yeah, they're the hustlers. They're the ones that were born with a vascular surgery mindset and a business mindset. Right?
Exactly. Yep. So if I chose to not meet with my ER physicians except, over coffee
Right.
to like talk because we're friends. But so I think that's the range in there.
Okay, cool. Back to just your career in general. What do you find as you look back so far on your career? What's been the most gratifying part of it?
That's a good question. I think that the teaching is one of my favorite things. And when I can do, so I did a fistula, it's July, well, it's almost the end of July. And I did a fistula creation. So it's an open surgery with a new intern. And I let him do a couple stitches in the anastomosis, where we connect the vein to the artery. And the next day, he's like, Dr. Mannoia, I got to tell you, I called my mom after that. That was so freaking cool. So I was like, yes, that's wonderful. Like that gives me, the goosebumps. I really like that. I had an attending tell me when I decided to go into academics that he said, you'll never be the surgeon that you might have been, because, I don't do a lot of my own, I oversee obviously, but there's a lot where I'm letting the residents, be supervised and do it. And, but I think he said it's 100% worth it to be able to pass that along. So I think that's been the most gratifying. The medical students, the residents, the fellows, and then seeing them kind of fly on their own. I'm to the place now, 4 years in, where some of the residents that I had as interns and second years are graduating and they're going into vascular. And I like to think again that I had some kind of a hand in that.
Oh, so you're like a work mum and a home mum. That's great.
Definitely, that's me.
You're seeing your children fly.
I am. Like warms my heart. I really like it. Yeah.
Now, as a leadership role in that capacity, is leadership in this academic setting something that you always thought you'd do, or is it something that kind of again you fell into?
I think that I definitely fell into it. I have never been a public speaker or, I didn't run for office or anything like that. I didn't think of myself in that way. But I have realized, I guess maybe things looking back, over my short career, but also including like residency and fellowship, the things that have served me the best have been when I can kind of reintegrate, like I didn't think that it would be revolutionary to ask for 4 months of maternity leave, but it was a little bit, and I like the fact that I can maybe lead in that kind of change. And in the vulnerability, I had a lot of people tell me that I would never make it as a surgeon because, I was too nice or too this, or I had one attending tell me after a really good case, I skipped down the hallway, and he's like, you're never going to make it as a surgeon if you're skipping in the hallway. I was a medical student. I don't skip now unless when nobody's watching, but those kinds of things, I think I have come to see are what is needed. And so if those are the things that I can lead in normalizing or, destigmatizing or changing the culture of my field and medicine in general, then I feel like that's kind of where God has been like, all right, I'm putting you up there, you're not a public speaker, but this is something I want you to do. So. Yep.
There's a need here, and guess what? You're the person.
Yeah. That's it. So, yep. Put me in, coach. That's what I just have to say in the morning. All right, God, put me in.
What's the next challenge? Let's do this kind of thing.
Oh golly. I guess In specifics, they asked me to be this is all very fresh and vulnerable. So this is like legit challenge, not like the kind where you're like, oh, this is a negative, but it's actually a positive. But no, that I have just started as the director for wellness for the Department of General Surgery.
Oh, congrats.
And thanks. I don't know what that's going to look like. I have all of these ideas kind of swirling in my head about ways that could go. And so my next challenge is going to be essentially putting my money where my mouth is. Like, what does that mean to be a surgeon who is well, and not that I am all the time, but how can I bring that into a field that I love? Integrate those things.
Wellness is coming to the forefront in medicine. Is there any advice that you would give to students who, are walking into a career where it is important? How best can they help themselves in that regard?
That's a good question. I think maybe get to know what you need, maybe. What re-energizes you, be aware of that. Like right now, especially in medical school, you have time to do everything. And so in general, you'll feel okay, but figure out after a long study session, like, is it exercise? Is it reading a book? Is it, going to church? Is it hanging out with your friends? Because as you get into medicine, there will be a lot of the fluff that has to fall by the wayside. And so if you know a highly effective way to kind of re-energize yourself, then you'll know exactly what to reach for when you need that, maybe.
Great. That's good. Some really good advice. I know we're time's running short, so let me finish off by asking you this question. Amit, if you were to talk to your younger self now, or other students now, knowing everything, your journey now, what's that pearl of advice that you would give to students?
Trust your gut. There's a lot of, especially now where everything is like analyzed and you have data on all of these things, you can look at the salary, you can look at the hours, you can look at, anything, the caseload that you're going to be taking on or what kinds of patients. But I think for me, to circle back, this has all been divine. And I think that's how God talks to me, is through my stomach in multiple ways. But I think that if you stay kind of true to who you are, what your strengths are and what brings you joy, you can figure out everything else.
Oh, that's some really good advice. Well, thank you, Dr. Mannoia, for on behalf of the listeners. Thank you for sharing some very, very valuable, not only like medical information, but pearls of wisdom. So we got to do some philosophizing right here today.
I know, right?
So thanks for sharing that. So
yeah, and if anybody needs to know or wants to know anything else, I'm always glad to chat or talk or email back and forth. Or yeah.
Perfect. All right. Well, that concludes our episode for today. Ask Alumni is a podcast of the Alumni Association. If you'd like to hear more podcasts like this, please visit our website at lusmaa.org/podcast. And if you have any questions or want to see another specialty covered, email us at lusmaa@lu.edu. For now, I'm Calvin Chuang. Have a blessed day.